6:37. Now a look at COVID-19 in our state. Positive cases plunging to a little over 600, and 7 additional deaths were reported yesterday. But that doesn't mean we've suddenly conquered the virus here. Remember, we typically see lower numbers over the weekend and on Mondays, and the data is likely even lower due to the holiday weekend. Another reason is testing. The number of tests being administered continues to be extremely low. Hospitalizations are also down, but we still have more people currently being treated for COVID-19 than we did right before the July 4th holiday. President Trump and Democratic presidential nominee Joe Biden spending their Labor Day on the campaign trail. The two clashing over just how much Mr. Trump can be trusted to deliver a safe and effective COVID-19 vaccine. Francesca is back with more details on this one. Fran?
Yeah, the campaign trail has been set ablaze, and while campaigning in Washington, D.C. yesterday, President Donald Trump accused Biden and Harris of using anti-vaccine rhetoric, and this comes after Kamala Harris said, quote, she would not trust Donald Trump over scientists on a vaccine. And keep in mind, in Pennsylvania, while campaigning, Joe Biden said that more Americans need a COVID vaccine as soon as possible.
If I could get a vaccine tomorrow, I'd do it. If it cost me the election, I'd do it. We need a vaccine. We need it now, as quick as we can get it. But we have to listen to the scientists. Okay, thank you.
Biden and his very liberal running mate should immediately apologize for the reckless anti-vaccine rhetoric that they are talking right now. It undermines science.
Now, keep in mind that President Trump frequently links a vaccine timeline to Election Day, but claims that is not politicizing science. Now, here's what many of you had to say about this controversial campaign showdown. Trish writes, a vaccine may be delivered, but how effective will it be? Travis says, it's not about your health or your safety. It is political, about who gets to release a vaccine. And finally, Sharon, one of our insiders, says, there is no way I will trust a vaccine before next spring. I don't care who totes it. Good science does not work that fast. And again, that is a thought of many people, that this is very ironic that this vaccine is being promised before that November 3rd election. Now, keep in mind the CDC guidance is asking for health officials in all 50 states to be prepared to distribute a vaccine. Specifically in 5 large cities, they're asking CDC officials to distribute vaccines to high-risk groups and healthcare workers as soon as late October, early November. Of course, we'll keep you posted with this timeline. Use the hashtag MorningRushATL to weigh in on this one.